Hello, I'm Dr. Kelum Pelpola. I'm a physician and a geriatrician. So today I will be talking about vitamin D deficiency. Vitamin D is a very important vitamin for us in multiple ways. If we have low vitamin D levels, we can have problems like osteoporosis. That means we have problems in the density of our bones. At the same time, vitamin D is important in several other factors as reducing infections, reducing allergy tendencies, but at the same time it's very important to keep vitamin D levels at an optimal level to make sure that your muscles are in good shape. If you have vitamin D deficiency, that can cause problems with muscle bulk and the strength of your muscles. So if you have vitamin D deficiency, you may have weaker muscles. Especially this is important in older people. So how do you get vitamin D? You may have heard that you mostly get vitamin D through sunlight. That is true. However, there's a practical problem in countries like Sri Lanka because if you stay in the sun for too long, you may have consequences. It is probably also affected by the fact that we have a lot of melanin in our skin. When the melanin content in our skin is too much, that means we need to stay in the sun for a longer time to absorb even a small amount of vitamin D. So if you practically think of it, you need to stay in the sun for a longer time, which could lead to problems such as dehydration and risk of increased cancers in the skin. So this may not be very ideal for some people. How would you get vitamin D in your diet? You can get vitamin D in seafood such as shellfish as well as some mushrooms. So these are the things that you can naturally get vitamin D from. Apart from that, you can also get vitamin D from fortified foods, some milk products, and say things like milk powders, drinking milk, cheeses may be fortified with vitamin D by different manufacturers. So once you think of vitamin D supplementation, another important method could be tablets. But if you take tablets, just make sure that you check with your doctor before taking tablets. The main reason for this is that vitamin D is lipid soluble. So when a fat soluble or a lipid soluble vitamin is there, if you have excess of it, it gets stored in the body and it will not go out with the urine. So it may cause consequences which are not good for the body. Especially if you have excess of vitamin D, that can cause increased calcium levels and that can cause to problems like constipation, problems in like depression, changes in your psychology, renal stones, all those problems can happen. So you need to be very careful when you take vitamin D. Normally they are available in 1000, 2000 and 5000 international unit capsules. But if you have a higher amount of deficiency, you may need higher doses. But before you take the vitamin D, make sure you check with your regular doctor. Thank you.